fret if you are not able to stay for the entire time or you have to pop in and out. It will be available for you to watch afterwards. It'll be on YouTube, so you can just watch it indefinitely. But we'll go ahead and get started today. Welcome, everyone, and thank you for joining us. We are all here because we care about mental health. You are parents, caregivers, guardians, maybe you just work with kids. And mental health is a very complicated topic that I could spend a lot of time discussing, but we're only going to be covering the high points during the main presentation. And like I said, we'll have some time at the end for Q&A. So if you have any specific questions about your own family, your own child, or just any questions that you don't feel like we've got enough time to cover in our hour together, you are welcome to stay afterwards or pop in and out, pop back for that portion. And I also will include my contact information. I will share it in the chat right now in case you have anything that you need to get in touch with me privately. But I just realized I forgot to introduce myself. So my name is Caitlin Ensley, and I work at the Mental Health Association of East Tennessee. This training is being done in collaboration with Bearden High School, Farragut High School, and Hardin Valley Academy. So you're probably here because you have a kid or you work at one of those schools, but I'm glad to be here with you all today. And I hope you learned something over the next hour we have together. So to get started, I like starting with one of my favorite mental health quotes. And this quote was said by Abraham Maslow, who is famous for creating Maslow's hierarchy of needs, which is basically the theory that people need their basic needs met first, like food, warmth, water, rest, and safety, before we can begin filling other needs like belonging or even our mental health. And it makes sense, right? Like, how can someone think about their mental health when they don't have somewhere to sleep at night? But the quote says, in any given moment, we have two options: to step forward into growth or step back into safety. What I believe this quote is saying is that for our mental health to thrive, we can't just maintain the status quo. It's something we have to keep working on, even in those moments where things feel okay. And I also think it's saying that sometimes growth is really hard, but that doesn't mean that it's not worth pursuing. We are here today all in the same space together because we care about one thing, and that is our kids' mental health. And our role in that is not only to create a stable foundation for them to be safe, sort of that basic need. We want to give them that food, warmth, and safety. But we also want to look at the higher levels of that need. You know, we want them to be able to grow. And how we achieve that is done by not only in the type of caregivers that we are, which depends a lot on our own mental well-being, but also the type of environment that we are creating for the children that we are taking care of. So my goal for today, just a quick outline, is to give you the information and tools you need to be able to identify when you have a child that is struggling and then how to help them. So I'll share with you some statistics, some things that can put your child at risk or protect them from mental health struggles, some signs and symptoms that could mean your child is struggling, and what you can do about it. Specifically, we'll be talking about changes you can make yourself in your home and resources that are available outside of the home. I'll also be in touch, touch on about how the pandemic has affected everyone's mental health and has just made getting help harder. But before I go on, I want to take a second to introduce my panelists and my co-hosts, which I tried to add a third one, but I had trouble. I'm going to send you another invite now. But we have some counseling staff from schools. We've got Carmen Long, Leslie Lee, and Andy Tenry. They're all working at your local schools, And so you can get in touch with them if you have any specific questions, and they'll also be helping me moderate the Q&A and getting in touch with me if there's anything that they need to bring my attention to. So thank you everyone for being here tonight, and it's only made possible by the incredible work that the counseling team are doing in their schools. So to get started talking about mental health, even though we'll be spending our time together primarily talking about how to identify poor mental health and what to do when it's happening, I think it's really important to mention that mental health, which is a really complex message, like I said, it is so much more than when we're struggling. It is something that every single one of us has, and we work on every single day. When you've had a stressful day, so you decide to take a bubble bath or go for a walk. It's pretty gorgeous outside right now. I wish I was taking a walk with my dog. But those things we do to make us feel better, that bring us joy, that's mental health. When we lose someone close to us and we grieve for them, that's mental health too. Even when everything is going well, that's mental health. If everything is perfect, nothing is wrong, we still are being influenced by our mental health. People don't like to talk about mental health a lot because many times they just associate it with when someone is feeling unwell. And a lot of us come to the table with preconceived notions about what it does mean to be mentally unwell. But if we want to try to start shifting the conversation from, okay, we only talk about it when someone is not well, to all the time, we need to start talking about it all the time, even when it's great. Because when we start doing that, it can break down some of the barriers that we have that make those conversations so scary when we're talking about mental health. But whether someone is mentally healthy or not actually depends a lot on how they're feeling about their own mental health and well-being. Mental health is a very individual experience. For example, two people can experience the same thing. One person comes out fine and the other comes out heavily traumatized. Their outward behaviors may even look the same, but internally they're having very different experiences. I mean, just think about to yourself the number of times you have personally told someone that you're fine or you're okay when you haven't been. And take those feelings and apply it to what if you did have depression? What if you had anxiety, bipolar disorder? And sort of those fears that come along with that as well. Some people might not feel comfortable being open about their own feelings and may mask and pretend like they're okay when their world is falling apart. So this is very important for us to keep in mind when someone is struggling with their mental health, because you may not understand why someone is struggling, but honestly, it doesn't matter. I always say the worst thing to do with mental health is try to throw logic at it. I've personally struggled with my mental health, and I've tried to explain why, what, how, answer all those questions. At the end of the day, I'm my own individual person. My experiences are individual to me, and only I know what I'm going through. So when someone says they're struggling, it's really important for us to respect those feelings. So always try to take a step back to understand what someone is going through instead of thinking that their life isn't that hard or what they experienced wasn't that bad. If they're opening up to you and sharing that they're hurting, you need to take them at their word and don't make them prove that they're in pain, prove that they're struggling. When you're struggling with your mental health, it's hard enough. The struggle itself is hard enough without having to justify or explain why you're feeling the way you're feeling. So a great definition of mental health comes from the World Health Organization. They say that someone is mentally healthy when they achieve a state of well-being where they realize their own abilities, can cope with the normal stressors of life, can work productively, and are able to make contributions to the community. This is something we should always be working toward, not only for ourselves, but think about your kids when you think about this definition. I think these are things we all want for our kids. We want them to work productively. We want them to be able to overcome stressful situations. And the thing I love most about this definition is you'll look at it and nowhere in it does it say someone who's mentally healthy is free from illness. And I think that's really neat because just like physical health conditions, for example, thyroid disorders, which a lot of us have, or even diabetes, or other health conditions, maybe like heart disease, people can have them and still be well. They can still be on top of their symptoms, taking medication, doing what they need to so that they're healthy. And the same thing applies to mental health. Someone with depression, anxiety, bipolar disorder, obsessive compulsive disorder, any number of mental health conditions can still be mentally well and still have that condition. Half of people will have a mental health diagnosis at some point during their life. So those are things like I talked about earlier, depression, anxiety, etc. But that number doesn't include the number of us that will struggle with their mental health at some point, which is all of us. We all have problems in our life that challenge our ability to be happy and confident. You're probably sitting here, you could probably think of something today that happened that challenged your ability to feel mentally well. But how we address and cope with those day-to-day problems, that really is what shows the strength of our mental well-being. Because our mental health isn't an on-off switch, it's more like a thermometer. There are varying degrees of health and mental health. And even those with mental health conditions can experience those varying degrees of mental health. The simple fact that we have a mental health condition, although can make it harder sometimes to achieve that optimal health level. Just like anyone with a thyroid disorder can attest, it messes up your metabolism pretty badly, even if you're in normal range. And it can be hard to lose weight and other things. So same thing with mental health. Someone has a health condition, it can make it harder, but not impossible. And like I said, mental health conditions, they are very common. Remember, half of us will experience a mental health condition sometime in our lifetime. And that number, if we look at it on a year-to-year basis, that's 1 in 5. It's because some people have lifelong mental health conditions. Other people experience what are called episodes, where they only experience those symptoms for a set amount of time, usually somewhere in the months to years range. But those statistics apply both to adults and our young people. So 1 in 5 of our young people, especially high school students, could be diagnosed with a mental health condition sometime this year. And the severity definitely does vary person by person. You have people that are very high functioning, and most do fall into a mild or moderate expression of their symptoms. But about 5% of the population have what's known as a serious mental illness, or as in the mental health world we like to call them SMIs or SPMIs. And those are mental health conditions that result in serious functional impairment that substantially interfere with or limit one or major life activities. And it depends on the person more than it does on the diagnosis. So someone with depression, that can be an SMI, but for most people, depression isn't. Same with things like psychosis or schizophrenia or bipolar disorder. Those tend to be more often considered serious mental illnesses. And the mental health needs of our young people, we know, have been increasing over the years, even before the pandemic. Rates of depression, anxiety, suicide, all up. And during the pandemic, some studies even showed that rates of mental health conditions have essentially doubled, meaning that 1 in 5 number is now 2 in 5. So instead of 20%, it's now 40%. But the interesting thing about that number, a lot of people expected suicide rates to go up, but the opposite has happened. The suicide rates actually went down a little bit before the pandemic, and they've stabilized. There's been no increase and no real decrease. On the other hand, rates of drug use and overdoses have absolutely soared and continue to remain high. And mental health conditions and substance use go hand in hand a lot of the times. But mental health issues affect children of all ages. They're definitely more common the older your kid gets, but that doesn't mean they don't happen in early childhood as well. So half of all lifetime cases begin by age 14. That means they're starting to experience those symptoms by age 14. not necessarily that they're diagnosed at that point yet. And 75% of mental health conditions, someone will start experiencing symptoms of those by age 24. So we've got those adolescent and young adults. And it's really important whenever we can to address those things while they're still under our roof versus going into college, moving away where so much changes. And a teenager who's not really doing that great can sometimes move out of the home, and then all that pressure of college can sometimes be the straw that breaks the back. So looking at the different types of diagnoses, you can see the most common diagnoses as well as the average age of onset. So anxiety, hands down, is the most common diagnosis for children and adolescents across all ages. You as parents, probably no big surprise to you. You've probably noticed in your kids anxiety. And anxiety is one of those things that it is a little bit harder to diagnose because there's a very fine line between understanding of what is regular stress and what is disordered anxiety. But the average age for behavior disorders is 11, and that includes things like ADHD, oppositional defiant disorder, and conduct disorders. Mood disorders, average age of onset is 13 years old. That includes things like major depressive disorder and bipolar disorder. And finally, substance use disorders, the average age is 15 years old, and that makes sense because the older kids get, the more access they have to substances. But people who do end up becoming addicted to substances, the average age that they first use their substances is 13. So that's something to pay attention to as well. But in the state of Tennessee, we also know, according to the Youth Risk Behavior Survey, that in the average high school classroom of 30 students, there are about 10 to 11 of the students who are going to meet the clinical signs of depression within the last 12 months. 5 to 6 of those students have contemplated suicide. 4 to 5 have planned their suicides, which puts them at really high risk of acting on it. And 3 to 4 have attempted suicide. And in that classroom, we know about 1 or 2 have made an attempt that has led to some sort of medical intervention. And so I talked to you and shared with you about how the pandemic has affected mental health, but I think it's really important to talk about why. So first and foremost, I think we can all probably still feel it, is the instability and loss of routine. And that wasn't just because at the start of the pandemic, everyone closed down, we didn't know what was going on. It seems like years and years ago, but it was only I guess it was 2 years ago now. But also, there were a lot of changes happening at home. Some people lost their jobs or started working from home. A lot of people retired. Some parents even had to leave the workforce to take care of their children because we know that daycare access can be difficult if you've got younger kids too. And I am hoping and praying that all the parents on this call today are wonderful, amazing parents. So I'm just going to make that assumption. But I think it is worth noting that for some kids, home is not a safe place to be. Being home versus being in the school is a hardship. And so that was difficult for kids as well. Beyond that, there's definitely increasing loneliness and isolation. A lot of kids are still reporting feeling the same feelings even if they're back in school. A lot have said they feel let down by the adults in their lives, like they feel they can't lean on them like they used to. And for those on this call, that may not be a surprise to us at all. We are all adults on this call, and think about how stressed and overwhelmed that you feel on a daily basis. Ask yourself, are you in a mental space where you feel like you can comfortably provide care to others? And so we've got these young people that are struggling with their mental health. We have adults who are struggling with their mental health, and no one is in a space where they can be resources for each other. So it ends up just being a perfect storm for everyone feeling like they can't lean on each other. And then, of course, we do have the extra concerns of becoming sick, or we have already gotten the virus, which we know there are some mental health components to actually having COVID, which I won't have time to go into today. But lastly, most of us have lost someone close to us over the last couple of years. My grandmother, she died December of 2020. I didn't go to the funeral because it didn't feel safe. But some of us may have lost people to the virus, some because of other reasons, but grief and loss are always really, really hard. And because of all the changes and losses routine, it's made that process different and harder to experience in a way. So the pandemic and those other factors that came along with it, those are just a few things that can put our children at increased risk for mental health issues. But there are other characteristics and life events that can put them at risk or protect them. And once we're aware of these, we can be proactive to remove the ones we can, mitigate the risk factors we can't remove, and insert as many protective factors as possible. So mental health conditions are at their root medical conditions, except they live in the brain, and the brain is kind of like the deep ocean of the body. We don't fully understand how everything works. But we do know how well the brain works depends primarily on two factors: our genetics, kind of what we're born with, and then what we grow up around, the sort of nature versus nurture. We can't do really anything about our own personal genetics or the genetics of our children. That's already been set in stone. But when we're looking at environmental risk, that's where we can really start being very aware and critical of the type of caregivers that we personally are. So when we do that, it's important to not only look at our own history of mental health problems, the type of traumas that we've personally experienced, and how those could be affecting our children in negative ways. No one, myself included, likes to admit our own faults and shortcomings, but when we do, or at least we try, which that's all I ask for, is for you to try, that knowledge is going to be really important to understanding the issues our children may be facing. It does no one any good to be in denial. It's okay if you've experienced things in your life that are traumatic. Maybe you are still experiencing them. But like I started with today, we know sometimes growth is hard, and sometimes we even feel safe in our traumas, safe in the way that we're currently experiencing life, even if it isn't great, because it's something we know. But we really need to start acknowledging our traumas and the places where we could use some growth in our life, so we can just have that awareness and move forward, and not be like this dog in this meme where we keep telling ourselves that everything is fine even when it's not. So first and foremost, we really do need to look at genetics. So if you or a relative has a mental health condition, whether it's something they or you are currently dealing with or have dealt with in the past, your child's risk increases. Second, certain life situations known as adverse childhood experiences, or ACEs, can increase your child's risk. The more of these we or our children have, the higher risk they are of not only having mental health issues, but it also increases suicide risk and it decreases their overall life expectancy. ACEs include events like abuse, neglect, other types of household dysfunction, like domestic violence, incarceration of a relative, divorce, or substance abuse. And then there are extra traumas that you can add on top of that aren't necessarily considered ACEs, but things like natural disasters or bullying. If you haven't done so, I highly encourage you just to do a quick Google search and find an ACE quiz and find out your own ACE score. I'm a 4, which I know puts me at a much, much higher risk for a lot of health conditions and just lower life expectancy. It doesn't change my life, but now that I'm aware of it, I can hopefully make changes for the better. But when someone experiences trauma, it triggers a stress response in their brain. And the persistent presence of stress chemicals, they can lead you or your child to form unhealthy, disruptive, or addictive behaviors as a way of coping. Childhood is a really critical time for brain development. And the brain is very plastic, but at the same time, when it forms those connections, they're like rock solid. That's why when people start, like say, for example, someone has their first cigarette, I think the statistic is like before 22 or 24, they're 10 times more likely to become addicted to nicotine. So those connections are a lot easier to form in childhood. And when a child is forming those unhealthy patterns of behavior, it can lay a really rocky foundation for development, which is why it's even more important for us to intervene as soon as possible to address the sources of trauma and any unhealthy ways of coping. And it can be a little disheartening looking at risk factors. We wonder if there's anything we can do to protect our children. And there are probably people on this call that have been in abusive relationships that their children were exposed to. There has been other traumas that you've experienced, like natural disasters or the loss of a family member to death. All of those things are traumatic, and it can seem a little insurmountable of how do I protect them? But we need to accept that we don't have control over everything. Self-awareness is really important, and we need to work on removing as many traumas as we can and improving our child's safety. But when we've experienced our own traumas, they can make it harder for us to be the type of parent that we want to be and make good choices. But just the fact that you're becoming more aware and trying is a lot more than a lot of parents do. And there are definitely times when we can't remove our kids' exposure to trauma, but we can build up their resilience. Resilience is someone's capability to withstand future stress and catastrophe. So let's say we're looking at our child's mental health like a foundation. Genetic predisposition and trauma, they put cracks in the foundation. But resilience is like adding extra supports to the foundation. It doesn't fix the fact that the cracks are there, but it does mean the foundation's not going to come tumbling down. And resilience is what protects our children despite the negative circumstances, and it's why two people can come away from a traumatic or stressful situation feeling very different ways. So some signs that you could have a resilient child include if they have close and healthy relationships with friends and family, if they view themselves in a positive way, if they can manage strong feelings and impulses, especially in a healthy way, if they are good problem solvers, if they have good communication skills, if they feel like they're in control of their life, and if they're able to find positive meaning despite traumatic circumstances. Some of these things are innate, but they're also skills that we can work on. But I do want to add a caveat about this. We want to build up these factors, we absolutely do. And because they can absolutely make a difference in our child's life, but they will make less of a difference if we're in an environment that make achievement difficult. For example, let's say we live in an area where there aren't a lot of resources, things like libraries, parks, access to healthy foods, or accessible and affordable health care. When someone lives in an environment like that, it's really easy to get hopeless, and hopelessness is the biggest barrier to building resilience. So we've discussed what mental health looks like and discussed the things that can contribute to good or poor mental health. So I want to share with you now, how do we recognize what are some of the signs that could indicate our kid is struggling with their mental health. And this doesn't necessarily mean they have a diagnosis. Diagnoses help in terms of understanding your own thoughts and behaviors. But when you're first starting the process, I try not to bring up diagnosis at all. I think it's more important to recognize that your child is struggling versus putting a label on it. So remember, most of our children with mental health conditions will start having those symptoms by age 14. So all of you are probably here because you have a kid in high school or you work with high school students. That means it's probably, if they're going to have a mental health condition, they probably are already exhibiting symptoms. Symptoms of mental health conditions, they're not occasional things. So if you notice your child exhibiting these signs for almost every day for 2 weeks or more, it's time to intervene. And it is worth noting that one of these signs in isolation may not be as much cause for concern, but the more of these that are present, the more likely it is that something is going on that requires intervention. So starting with the physical signs of mental health issues. Physical warning signs are things you can physically observe and relate to your child's physical health. So first, changes in eating habits. Eating either too much or too little. Also with eating, you want to pay attention to an obsession to eat healthy. Just because someone is at face value getting healthy doesn't mean the reasoning behind it is. Also, sleep disturbances that can include sleeping too much or too little, not being able to fall asleep or stay asleep, or new or persistent nightmares. They may also seem fatigued or tired, even if they are getting enough sleep. Reports of new aches and pains that can include headaches, migraines, stomach pain, or other physical symptoms. But physical complaints related to mental health stuff do tend to be more vague. And physical complaints like stomach aches, they're really common for anxiety disorders. Like when my anxiety is really bad, I feel like am super nauseous and don't want to eat anything. And the last physical sign I want to talk about is weight loss or gain. If no other symptom is accompanying it, it might not be as much of a cause for concern, especially during this time of rapid physical development in adolescence. But when someone is struggling with their mental health, sometimes they do start to eat more, have a larger appetite, use food to cope, or may start restricting their food intentionally. Or sometimes, like I said, they just lose their appetite and they just don't want to eat. But on top of those behavioral changes, I said at their base, mental health conditions are brain conditions. And sometimes because of the change in the chemicals in their brain, it changes at their basis level, things like their metabolism, and it could lead them to lose or gain weight. But there are also emotional and other behavioral signs to be on the lookout for. If your child becomes more aggressive, stubborn, hostile, or prone to outbursts, also pay attention to grades. A sudden shift up or down may indicate a change in their mental status. Like if you've always had a C, D, B kid, and they're suddenly making all A's in all their classes, what happened to help them get there? Is there a reason? Or is there some mental change that's going on that's leading them to become more obsessive about their homework, about their grades? So that's something to pay attention to. Also, losing interest in activities. That may mean they stop doing something that could be a hobby, a sport, anything they enjoy, and they just stop doing it, or they keep doing it and they're like blah about it. Your child may also show difficulty concentrating or focusing, avoidance of certain places or people, or just avoidance of people in general, regression to behaviors present at a younger age. For example, they may start wetting the bed or sucking their thumb. There might also be changes in physical appearance. For example, if they stop showering or bathing themselves or even grooming more. And I'm not talking about changes in someone's type of fashion. If your kid suddenly starts wearing all black, I wouldn't take that in itself as a cause for concern. But you do need to pay attention to what parts of their body they have covered, because if they always have their shoulders, their legs, their stomachs covered, that could mean they're being very intentional about that and they're potentially concealing self-harming behaviors. You also want to pay attention to new or more intense use of substances to cope that does not just include illegal substances. It includes those prescribed by doctors, like ADHD medicine. It includes nicotine, which a lot of high school students do have access to, unfortunately. Even caffeine, that is something to pay attention to. Other risk-taking behaviors, also isolation, restlessness, new or recurrent fears, persistent sadness or frequent crying, self-harming behaviors is definitely something that is very concerning for parents. And just a couple quick things about it. It's not just cutting. It is when someone harms themselves physically in any way. It doesn't necessarily mean that they are suicidal, but they could be. But it could also include someone burning themselves if people pull out their hair, or males are more often to hit themselves as a form of self-harm. And you may not be able to see the actual self-harming behaviors or see the physical signs, but let's say you start noticing razors missing in your home, or your child is increasingly spending more time alone with the doors closed, whether that be their bedroom or the bathroom, or always covering certain parts of their body. That may mean that they are self-harming. And the most common self-harm locations are arms, wrists, shoulders, stomachs, and thighs. And there is some research to say that if your child is going above and beyond and concealing those self-harm locations, that could mean things, their level of functioning is lower than those who don't care if other people see their self-harm injuries. And the last thing is if they start talking about death or dying or making vague or direct suicide threats, they are definitely experiencing some form of mental distress. It's one of those like, stop, don't collect $200, don't go past go. You have to intervene as soon as possible. No ifs, ands, or buts about it. So I could have been going through that list, and maybe some of you sitting in this session right now are thinking, I am concerned about my kid. But maybe you could also be thinking, is it just adolescence? Is it growing pains or teen angst? Well, I will talk about some things in a second that will hopefully help you tell the difference between the two. So there are 3 areas we need to look at: intensity, duration, domains. So when looking at intensity, do the symptoms come and go, or are they more persistent? If they're persistent, it's probably a mental health condition. Even if they're mild but chronic, probably a mental illness. Are they disruptive? Are they engaging in self-harm or having suicidal thoughts? So if the symptoms are persistent, chronic, or intense, probably a mental illness. Second, duration. Does the moodiness come on suddenly and is gone moments later, followed by many days of calm and normalcy? That's probably just teen angst. But if the moodiness is more chronic and lasts for longer periods of time without breaks, there is likely something happening. Also with female children, pay attention to their menstrual cycles. Premenstrual dysphoric disorder is incredibly common, and some women may actually meet all the diagnostic criteria of depression the week before their period and the week of their period, and it can be really distressing. And then when it's passed, suddenly feeling better, and then a couple weeks later, all over again. So pay attention to that as well. Lastly, domains. Are their symptoms interfering with their home, school, and social life? Mental health conditions are pervasive and they affect every domain of someone's life. So it's not just going to be present at home or school. It will be present in their social life as well. So if you notice any of those signs of a mental health condition, the sooner you can get your child help, the better. Unfortunately, most people from onset of symptoms to when they get help is 10 years. And your role as a parent is to do everything you can to not let your child get to that 10-year mark. And ultimately, you can absolutely make most of your child's healthcare decisions for them. But the outcome is going to be much, much better if they're a willing participant. I don't recommend forcing your child to receive psychiatric treatment without their consent unless you've exhausted all other options first. The best thing you can do for children, regardless of if they're struggling with their mental health or perfectly fine, is working ahead of time to create an environment where conversations about mental health are normalized. So bringing mental health in your home as often and as consistently as you can. So first and foremost, model sharing about your own emotions and challenges positively. Show your child it's okay to talk about feelings. Be open and honest about how you're dealing with your feelings and emotions, and it will make them more likely to open up. Doesn't mean they're definitely going to open up, but you have to lead by example. It's okay to be vulnerable. It's okay to be self-deprecating, and it's okay to be prideful and proud of yourself in those moments where things are really good. If you personally struggle with a mental health condition, please don't be afraid to disclose it to your child. If you take medication or see a therapist, even if you do yoga or take baths to calm down, talk about it. Because children are so perceptive. You know, there are two forms of learning. There's what you teach verbally, show your children, and there's what they learn through observation. And sometimes that observational learning is even more powerful. So when your children notice you struggling with your mental health and also notice you not talking about it, they make the connection in their heads of mental health, something wrong, I'm not going to talk about my own. But with both of these, it's really important to not stray into the category or territory where your children feels like they have to take care of you. They are not your peer. It's not like going out and having a friend catch-up date where you talk about the ins and outs of your life. You don't want to do that with your kid. You can talk about your mental health with your children, but it's really important to make sure you're getting the help that you need, that you're taking care of yourself so your child doesn't feel like they have to parent you. Some other things that we can do to create a more mental health friendly environment: asking our child questions every single day, and ask open-ended, direct questions, like instead of how was your day, asking what was your favorite part of today, or what was something that was frustrating for you today. Help your child set healthy boundaries for themselves that prioritize their mental health. So make it okay for them to say no to hang out with their friends if they're feeling overwhelmed. And another thing you can give your children that influences their mental health positively and is a boundary is privacy. Give your child time to be alone in the comfort of their own space in order to self-reflect and reset. There are also things you can integrate into your daily life that are just good things to do all around. They're good for you, they're good for your kids. Getting good sleep, having as healthy diet as possible, and getting regular exercise. It doesn't have to be going to the gym, doing like high-intensity cardio. It can be going on a walk after dinner, especially now that we're in this awful daylight savings time and the days are longer in the evening. It could be a good opportunity. Also, you'll want to create a consistent routine to the best of your ability. So having some sort of regularity in your schedule, especially for those that struggle with their mental health, consistency is really key in just maintaining our mental health baseline. Also create a sense of belonging. Remind your kids that they're important and valued members of the family. You know, you may think, I tell my kid I love them all the time, but think about a special way that you could recognize your child for what they bring to the table. So maybe complimenting them for their creativity, their thought process, or maybe they do something really nice for a sibling. Think about it in creative ways and make sure you mean it when you say it. And then plan intentional time together. Of course, this is good for our mental well-being because social connections are really important. But also when you have that consistency of being around your child, you can start to recognize when something is going wrong, and you can step in and be like, okay, something's going on. Let's try to figure out what's going on. And we do want to promote resilience, finally. So those things I talked about earlier, things like building those social connections, teaching them to be problem solvers, all of those things help our kids build hope. So even when they're feeling down, they feel like there is another side of that. Because challenges and adversity are natural parts of life, and the way you respond to them in your own life are going to directly affect how your child is going to respond to them. So be open with your own grief or frustration. Let your child know that you experience a range of emotions. It's okay if they do. And we want to try to build up those factors of resilience in them. So chances are that your child is going to deal with some sort of mental distress in their lifetime. Our hope is that we have created the type of environment where our children feel comfortable talking to us about it. Even if we've had a really close relationship with our kids, when our kid is struggling, that may not always happen. They may not always come to you with what they're feeling. And therein is the complication of mental health. It's not like when you break your leg, it hurts, okay, let's go to the doctor. When you're struggling with your mental health, your thoughts and emotions are distorted. They are dysfunctional. They are not what they should be on your baseline healthy level. So your mind can make you start believing all kinds of things, even if they aren't true. So you may start feeling that nothing you can do will make it better, so what's the point? You may worry that people won't take it seriously and they won't understand, so what's the point? Or they may worry that people will judge you. Or if they're like me, when I'm struggling with my mental health, I get in my mind that it's just a momentary setback, and if I try hard enough, pretend like everything's fine, everything will be fine. Kind of that fake it till you make it mentality. But all of these assumptions and fears, because of someone's personal history or mental health condition, they can lead people to mask or pretend like they're fine and close themselves off. They may even start pushing the people away that care about them most or that they cared about most in the past. That sometimes means you need to initiate the process by starting a conversation, and it'll probably be the scariest conversation in your life. But the first step is much more powerful than people know. Mental health, as a rule, tends to make people very uncomfortable. And even me in this job, it makes me uncomfortable too when I'm talking to people I care about it, if they're struggling, because it's much more real in that moment. You worry about saying the right thing. You worry what you could do would make things worse. But don't let those fears keep you from starting that conversation. Just talking about it can have a really big impact on your child's mental health. Even if the conversation goes awfully, even if they're not willing to talk to you, it's an acknowledgement of something is going on. They may feel seen, and it's like they finally see it. My sister struggled with her mental health for very many years. She was a chronic self-harmer, and she and I had a conversation a few years ago. She has long been in recovery, but I'll never forget it. And she said to me, quote, "I don't know how no one knew." For 3 years, no one in our family knew what she was going through. And looking back, I can see the signs. But I didn't have the information then that I do now. And so what we're dealing with our kids, it's important to just start that conversation, because it lets them know that they are being taken seriously and we see them. So the most important thing in starting this conversation is we do want to choose the right words, because choosing the wrong words can leave our child feeling stigmatized or shut down. Unfortunately, it is impossible to know the right words to say in every situation. But something you can control is the intention that you approach the conversation with. So always start from a non-judgmental and caring place, and realize that even though you were your child's age once, you don't know what their experiences have been. Don't make any assumptions about what they're feeling. And lastly, try to keep a hopeful perspective. When someone is struggling with their mental health, one of the things they struggle most with is hope. So it's your responsibility to hold the hope for them, the hope that things can get better. And that doesn't mean telling them that things will get better. That's usually the last thing you want to hear when you're struggling with your mental health, because honestly, it doesn't feel like things are going to get better. What I mean is that you need to be hopeful that things will get better. So you can keep pushing and you can keep trying. It's really hard to have that same persistent energy when you're struggling with your mental health. Beyond approaching the conversation with the right intention, there are little things you can do to set it up for success, and these are straightforward, like making sure you're not preoccupied. Don't multitask. Keep eye contact. But not only paying attention to what they say, but also how they're saying it and what their body language looks like. A good way to start the conversation is by just telling them that you've noticed some changes in their behavior and that you care about them and you're concerned. So you could bring up a specific behavior. Don't label the process and bring up anxiety, depression, or another mental health condition. That can leave your child feeling labeled and confrontational. But remember to ask open-ended questions and that require more than just a yes or no, because then they may shut off and be like, yes, I'm fine. No, I'm not. And they just try to get out of the conversation. Acknowledge and embrace the fact that it will probably be uncomfortable. There has been a lot of movement in how comfortable people are talking about mental health, but when you're trying to talk to your child and your parent is trying to talk to you, that's probably a little more uncomfortable. So don't try to expect an immediate connection. Even in the past, your child's been really open with you. Just keep being persistent and don't give up and keep paying attention. And it's absolutely okay if your kid doesn't want to talk to you. They don't want to talk to you. It might be the next question you ask is, would you want to talk to someone else? And that could immediately open up the door for them to talk to a counselor. And as long as we approach the conversation with good intention, really listen to our child and be persistent, we are going to be setting ourselves up for success. But if we want to be even more successful, it's important that we examine the type of words and language that we use as well. There are some words and phrases that you do want to avoid when having these conversations. Typically, when someone is struggling with a mental health, even if they're not alone, they do feel very alone. They may feel like they're doing something wrong, they're in pain, and they can't figure out why. I remember when I first started struggling with my mental health, going to my doctor because I thought I was physically ill. So language that is punishing or patronizing can reinforce the message that they're thinking in their mind. So some examples of phrases that are punishing or patronizing that we want to avoid are, you're so smart. How did you let this happen to you? Or what did you do to get depressed? Or even things like, I understand. Because this phrase can come off as patronizing, even if you have gone through your own period of being mentally unwell. Like I said, we never want to assume our child's experiences. So maybe instead say something like, I have been depressed before, but that doesn't mean that I don't know. That doesn't mean that I know what you are feeling. I promise that I'll listen to you and we're going to work through this together. Some other things you don't want to say are things like calm down, or any phrase that uses the word finally, like, oh, you finally got out of bed. Reward changes in behavior. So let's say your kid has been sleeping all the time. They're depressed. When I was depressed, I was sleeping probably 11, 12 hours a day. I was exhausted constantly. So instead saying something like, hey, you woke up early today. Want to go get some breakfast with me? Simple change, and you're still getting across what you want. You also don't want to call them dramatic or say that they're doing it for attention. And we don't want to push our beliefs or assumptions onto our kids. We don't want to rationalize what they're going through and tell them they shouldn't feel that way or things aren't that bad, because that can increase their troubling feelings of, if something is wrong with me, and nothing will make it better. Because we do want to create a safe and open environment for our kids to talk to us, and just realize they're individuals. not only in their experiences, but how they perceive those experiences and what they need to cope. For a child that's struggling with their mental health, sometimes all they need is changes in their routine or home life. But there are times when outside help can be really beneficial. Think about how stressful it is just taking care of your child and just being a parent. And when your child starts struggling with their mental health, that can make it even harder. It is hard taking care of someone that is struggling with their mental health, and I think that needs to be acknowledged. But not everyone with a mental health condition needs clinical intervention. You really just need to make that determination based on your child, what they want, and your family. So children with mild symptoms may be able to manage them through healthy coping and self-care, things we've already talked about. But when self-care doesn't address the symptoms, then we want to take the steps we need to get our child professional help. So, however, if you do have concerns your child is self-harming or suicidal, instead of doing anything else first, you need to remove lethal methods from your home. That means locking any firearms, and making sure medications are safely secured, and then proceeding after that. So generally, if you've got concerns about self-harm or suicide, you would skip the primary care step and go right to seeing a mental health professional. But for just every other concern before that, you are going to want to start by checking in with your primary care doctor or your child's pediatrician, because there are some physical health conditions that present as mental illnesses. Things like thyroid disorders and anemia can both look like depression. So your doctor will want to exclude any physical causes, and the next step is talking to a counselor. When finding a counselor, it is important as much as possible that your child be involved in the process, whether that be doing research on the different types of therapy or therapists in your area. Most private practices will make available descriptions of their therapists so they can read and learn about them. Your child's therapist will also, if they're a good therapist, they'll want to involve the parent in the child's treatment process, but there is a certain level of confidentiality. A therapist should not be telling you details about what their child says in session. They can talk to you about certain steps you would need to make in the home to be more supportive of the child, however. And they aren't expected to disclose anything to you unless your child is threatening to harm themselves or others. Major red flag if they're telling you anything more than what I shared, like should be losing their license, major red flag. A few other things to note about therapy. If you're nervous or uncomfortable with the idea of leaving your child alone with a therapist, please take the time to get to know them. You should also be able to sit in the general area of the therapy session, where depending on the setup, that may mean sitting in your car or outside in the waiting area or even in the room, depending on the practice, right outside the room. If your child's therapist is not letting you do that, again, major red flag. But finally, in the state of Tennessee, when it comes to mental health care, youth at the age of 16 can consent to their own medical care. This is called the mature minor exception. And that means at the age of 16, your child does not need to seek parental approval to get into therapy or to exit therapy. So that is really important to know, which is why it's important to have them as a part of the process in a willing way. Medication is also something that's brought up as part of the process. It's best practice for someone who's in therapy to take medication because it regulates your brain chemicals a little quicker, so the effects of therapy can take place faster. But you need to make the decision that's best for you and best for your kid, and again, involve them in the process. Recovery from a mental health condition is not one and done. It's an ongoing process. Don't pressure your child to be normal. Learn and accept and appreciate their new normal. Because even though mental health conditions can be debilitating, they don't have to be, and how you react to and support your child is going to make a huge difference in their success. Don't expect your child to improve immediately if they've started mental health treatment. Don't give up if there aren't any changes. Recovery isn't linear. And for some people, the traditional medication therapy approach doesn't work. That's why there are novel treatments, things like transcranial magnetic stimulation and brain mapping, all this really cool stuff. But we have to start at that baseline because that works for 50% of people. And to finish up today, I wanted to give you a few more resources that you can take with you to learn more about mental health, because really, this is only the tip of the iceberg. This is my contact information. Again, you can reach out to me anytime for any questions about your mental health in general or about yourself or your kid. We also have a call center at the Mental Health Association that you're welcome to call if you need referrals to a treatment provider. And your school's counseling team, wonderful resource. And there are other people in the school that are great resources as well. There are, in all the schools, there are social workers, sometimes there are psychologists, as well as school-based behavioral health liaisons or school-based therapists. And finally, I've included some links to some very informative websites where you can access their information. Mental Health America is really great because they offer free mental health screenings. And then my personal favorite in this list is the Child Mind Institute. They have some really great articles that break down certain mental health things step by step for parents and how to approach them with your kids. And I wanted to finish off by sharing some local outpatient providers. Outpatient is what we typically think of as therapy, where you go in, you're there for an hour, and you go back once a week. I've included a variety of providers on this screen, from community mental health centers like McNabb Center, also known as Helen Ross McNabb, and Cherokee Health, to also some private providers in the area. There are a lot of mental health providers in the area, but it is worth mentioning that we're in a workforce shortage right now, so wait times can be a little bit longer. And finally, some crisis resources. When your child is in crisis, that means they're at risk of harming themselves or others. That means your first line of defense in crisis is calling mobile crisis. And it is a 24/7 number. And when you call, they will have a clinician do the assessment to determine the best course of action. That doesn't always mean hospitalization. Sometimes it does. However, they are not going to respond if your child needs immediate medical intervention in cases of physical injury or overdose. They will also not respond if you are personally in fear of your own safety. So in those events, that's when they're going to recommend that you call 911. When you call 911, be explicit about the fact that your call is related to mental health. If an officer responds, whenever possible, working with law enforcement, see if they can provide a CIT or a crisis intervention team officer. These are officers that have received special mental health training to better intervene in those situations. But there are also co-responding teams. Here in Knox County, we do have a co-responder team where a police officer and a mental health professional go out together to respond to mental health situations, which is really great. And it's the reason I say to be so explicit, and it's unfortunate to be talking about, but it needs to be said, is that people with mental health conditions are 16 more times likely to die in confrontations with law enforcement than others. So be aware of that when you're making that call, and that's why I say to be so explicit. You can also call the police non-emergency number for what are called safety checks, where they literally just go to someone's home and check on their safety. So we're often used for adults, but can definitely be used with adolescents as well. Just a police officer knocks on the door, verifies that the person there is safe, and then they go on their way. Finally, a few national and statewide numbers that can be helpful. The National Suicide Prevention Lifeline number, the statewide crisis line, which is what I recommend before actually the suicide prevention number. And I didn't include it in the slide because it hasn't been rolled out yet, but coming in July, there's a new countrywide mental health number, and that's going to be 988, which will direct you through the call centers that accept suicide prevention calls. I know I'm going a little over, so I appreciate you all that have stayed with me. But I really appreciate the invitation to speak with you all today. And I will go ahead and stop the recording. And if anyone has any questions,